As President Obama and his team of behaviorists pushed the Hitler Useless Eaters program for healthcare, the words of Dr. Leo Alexander haunt our nation today. In 1949, medical consultant at the Nuremberg Trials, Dr. Alexander, penned an article in the New England Journal of Medical Science entitled Medical Science Under Dictatorship. In it, he not only indicted the policy of useless eaters as murder, but presciently warned that certain institutions inside the United States had already began on that same path and urged the U.S. to abandon that path before it was too late. With our president gearing up to pass his own version of Hitler's useless eaters law in the House of Representatives by July, we should revisit those warnings and listen very closely.
Physicians have become dangerously close to being mere technicians of rehabilitation. The essentially Hegelian rational attitude has led them to make certain distinctions in the handling of acute and chronic diseases. The patient with the latter carried an obvious stigma as the one less likely to be fully rehabilitable for social usefulness. In an increasingly utilitarian society, these patients are being looked down upon with increasing definiteness as unwanted ballast. Hospitals like to limit themselves to the care of patients who can be fully rehabilitated, and the patient whose full rehabilitation is unlikely finds himself, at least in the best and most advanced centers of healing, a second-class patient, faced with a reluctance on the part of both the visiting and house staff to suggest and apply therapeutic procedures that are not likely to bring about immediately striking results in terms of recovery. I wish to emphasize that this point of view did not arise primarily within the medical profession, which has always been outstanding in a highly competitive economic society for giving freely and unstintingly of its time and efforts, but was imposed by the shortage of funds available, both private and public. From the attitude of easing patients with chronic diseases away from the doors of the best types of treatment facilities available, to the actual dispatching of such patients to killing centers, is a long but nevertheless logical step. Resources for the so-called incurable patient have recently become practically unavailable. Is it worthwhile to spend a certain amount of effort to restore a certain type of patient? This rationalistic point of view has insidiously crept into the motivation of medical effort, supplanting the old Hippocratic point of view. Is it worthwhile to do this or that for this type of patient? Evidence of the existence of such an attitude stared at me from a report on the activities of a leading public hospital unit, which stated rather proudly that certain treatments were given only when they appeared promising. If only those whose treatment is worthwhile in terms of prognosis are to be treated, what about the other ones? Under all forms of dictatorship, the dictating bodies or individuals claim that all that is done is being done for the best of the people as a whole, and that for that reason they look at health merely in terms of utility, efficiency, productivity. It is natural in such a setting that eventually Hegel's principle of what is useful is good wins out completely. The killing center is the reductio ad absurdum of all health planning based only on rational principles and economy, and not on humane compassion and divine law. To be sure, American physicians are still far from the point of thinking of killing centers, but they have arrived at a danger point in thinking, at which likelihood of full rehabilitation is considered a factor that should determine the amount of time, effort, and cost to be devoted to a particular type of patient on the part of the social body upon which this decision rests. At this point, Americans should remember that the enormity of a euthanasia movement is present in their own midst. The case, therefore, that I should like to make is that American medicine must realize where it stands in its fundamental premises. There can be no doubt that in a subtle way, the Hegelian premise of what is useful is right has infected society including the medical portion.
Dr. Alexander's warning was issued in 1949, but it resounds loud and clear under today's genocidal HMO system. Look at where we stand now. Through the HMO policy, we've already dramatically reduced the number of people who receive real health care. We've reduced the number of hospital beds, let alone actual hospitals. We've even gone so far as to pass euthanasia legislation in places like Oregon and Washington State, and have even begun human experimentation on troops. And Obama wants to cut health care to continue this? Have we become a bunch of Nazis? If not, we can in no way tolerate Obama's Nazi health program. There is still time to heed Dr. Alexander's warning. LaRouche has called for the removal of the HMOs now, or else a few years from now, we might be holding a second Nuremberg tribunal for millions of unnecessary deaths. And this time, the people tried will not be wearing swastikas.